HBCU Digest, welcome back. This is part of our HBCU Voices of STEM Excellence series, where we invite conversation with the best and brightest from historically Black colleges and universities in terms of baccalaureate or graduate training, who are making exceptional moves in the science, technology, engineering, and mathematics field. Today, our special guest is Dr. Ebony Madden. She is a program director in the NIH Division of Genomic Medicine in the National Human Genome Research Institute, and a proud graduate of Howard University. So, Dr. Madden, it is a pleasure to have you on today.
Thank you very much, Jared.
So your work in genomics, it is something that is widely known in the scientific field, but to the layperson who hears a lot about public health these days may not be intimately familiar with the importance of genomics or what that field of study does. Can you kind of explain to our listeners, and particularly young people who are at HBCUs now and considering fields that they may want to enter as careers, why genomics is so important, and particularly to minority communities?
So first, genomics is important to everyone because it's pretty much the map of how your body will respond to everything, how your body will respond to the environment. It's the map of how your body functions. And so genomics is the base of everything. The coding that you have, as you know, we share our coding as humans. It's almost exactly the same. We just have a small amount of variance that may change how we respond and how our body reacts. So it's very important. It matters to diverse communities, especially communities that are affected by, communities that have had health disparities, such as the Black communities, communities in lower socioeconomic levels, is that if you have certain environments, your variant, and you have a variant that gives you a susceptibility to certain diseases, and you then happen to be in an environment that then gives you more risk for that disease, then you're at a higher risk than the normal population with that variant, because of one being a Black person or one being a socioeconomic level, and a Black person under the stresses, as you know, that we go through in life for just being Black, puts us at then even a higher risk than the normal population. So it matters a lot to understand your coding and understanding your genetics and how your body will react.
How did you get or become interested in this field? Tell us a little bit about your upbringing, your earliest exposure to science, and where did it get steered towards genomics as a specialty, and then your journey to Howard University for both your master's and your doctorate, and how that really shaped your career and leadership at NIH?
That's a great question. So growing up, my mother is a teacher, and she felt strongly about getting us involved in different things, especially in the summer. And so I have a twin brother. My twin brother and I were in this program called ACE, starting from middle school, and it actually involved you and it exposed you to the sciences, and you would go to different summer camps and be able to work with investigators to run different studies. And I love that. I love just learning about how things work in your body, and actually, seeing how the experiment ends, seeing how medicine works. And that just excited me. At that point, I thought I wanted to be a physician. I went to UNC Chapel Hill as undergrad. In all my education, genetics was my favorite course, but I still thought I wanted to be a physician until I did an internship, and I actually worked in the Cancer Institute. And Dr. Godley is the person that asked me about genetic counseling, and I had never heard about genetic counseling. And I looked into it, and it seemed just such a great field where it brought in the science, but then you actually work with patients. And going to a predominantly white university, my brother went to predominantly Black. He went to HBCU, North Carolina Central University, and he always would talk about how wonderful it was going to a HBCU. So I really, really wanted to go to a HBCU for graduate school. And that's what led me to Howard University in the Masters of Genetic Counseling program. And what I learned when I was doing my master's is I love the science. The counseling was not exactly what I thought it would be. You did not spend the time with patients that I thought you should spend. It was all about billing, and not the pediatric counseling, but the prenatal counseling and a lot of that. It was structured very different than what I had envisioned. And my love for science brought me to just go on and get my PhD in genetics and human genetics, and just go the science route, the wet lab route.
Those of us who are parents who've had babies, we're some of us are familiar with that term, genetic counseling. So that's so encouraging to see that, that a sister would even consider getting involved in that, because that's something that's very important, particularly for Black families. Talk about some of the differences, not necessarily bad or good, but what was different about your experience at Chapel Hill from Howard? And I know it's two different programs and it's two different cultures from an undergraduate to a graduate student, but what are some of the things that you would say that affirmed Howard as a good choice for you? And also, you kind of took an opposite route. A lot of our best STEM talent, they started HBCUs and they're kind of guided to predominantly white institutions. You kind of flipped it around. Was that part of the mentoring at Chapel Hill that said, hey, consider Howard? Or was that something you discovered on your own with, obviously with your brother's influence?
Well, that's the difference in going to a predominantly white university, especially majoring in the sciences. Our classes were 300 plus. Even your very advanced classes were that large. And so you really did not have a mentor to guide you like HBCUs do. Have a professor that really has interest and makes sure you're doing well. And that's something that I constantly heard from my friends and my family in HBCUs, that their professors always looked out for them. They knew when they weren't in the classroom. We had a joke among my friends that they knew we weren't in the classroom because the couple of dots in the group of 300 were gone. So it was a difference of your professors knowing your name, right, compared to, okay, I don't see the color, the couple of
these Black folks in here.
Yeah. And so I think that's what really led me. And even though I know graduate school, the classes are so much smaller, I had a group of 5 in my class. The professors really wanted to see you have success, and they were invested in guiding you and giving you that success. And I don't think it was just because you were on the graduate level. I think those professors just really cared, and they wanted to see where you go. Even, unfortunately, the director of my program, he has passed, but I kept in touch with him all the way till he passed. He wanted to know what I was doing, how I was doing. He always reached out, and we had the students. Even he connected me to people who had finished the program, who were doing similar things and had a similar drive to me, and just the passion I think HBCU professors have for their students in that drive. They're not there. Most large, predominantly white universities, especially research intensive universities, they're there to do research, and then teaching is what they're required to do. HBCUs, even though you may have some very advanced researchers and they're getting a lot of grant funding, they're still very invested in their students, in the teaching of those students, and guiding the next group of diverse researchers to come under them. So I think that was the difference.
So you would say that the teaching element is what makes HBCUs stand out a little bit, because you have world-renowned researchers and practitioners that are one-on-one with students, because that's not, I think people always wonder, why is it, HBCUs produce all these STEM professionals? Why are they so good at, this particular kind of profession, and Black students can go anywhere, but yet you see this pipeline that runs from HBCUs all over the place, all over industries. And you would say that that's the actual one-on-one teaching element.
I would say that, and also the mentoring element, not only the teaching, the mentoring element, where professors, they knew you enough to say, okay, this is your drive. I know about this. Have you thought about this? Graduate schools, and I have friends that went to graduate schools, they cared about the research and how well you did in your lab, but I don't know if they were really invested in you per se. And my professors, I had professors that were not Black, but still they worked at the HBCU for a reason. Mm-hmm. They really wanted to develop and feed in diverse people into what they were doing, and they cared. And I think, and I work with investigators all the time at NIH, and I work mostly with these very research intensive institutions, and it's the research that drives them. Not that they're not caring people, but it's the research that drives them rather than the actual people. That's the difference.
What would you say is so we obviously know that every industry is better suited when we have more diverse representation, more women, more people of color, obviously. But for the field of genomics specifically, why is it better suited when more sisters like you are involved and offering research, offering practice, offering management and guidance? Why is that so essential for America at large and the world at large to have a broader spectrum of expertise involved?
One is the point of view. I have sat in on meetings, and the diverse point of view and thinking about underserved populations, it's just not there because they're not living in that world. And so they forget to think about, okay, what does that mean for communities that don't have the access to this technology? They're just trying to build the technology rather than thinking of disseminating it, making sure everyone can actually benefit from the technology. And I think when you have diverse people in the room, that voice is then heard. Another is just research participation, and not just genomics, across the board. If you want diverse people to participate in the research, you need leaders heading up that research that look like them, because it's the trust level. And we've heard that feedback so much whenever they're doing surveys to try to understand, why are you not participating? What will help you to participate and get involved? We hear this message so much is there's nobody that looks like me. I don't think you understand where I'm coming from. But unfortunately, I think they blame it on the pipeline, but I think the pipeline is there. It's just giving people the chance. I think I'm not saying that we have a lot of people of diverse ancestry or a lot of people in color, but we do have some. And actually, if we put those people of color in these leadership positions, more people will see themselves in those positions and want to actually go there as well.
And then the final thing, what advice would you give, as I mentioned before, to an undergraduate or even a graduate student who is considering an HBCU for their career? What advice would you give them about how to maximize that opportunity, and why an HBCU could be, depending on the program and their area of interest, could be the ideal place for them to jumpstart, their professional life?
My first advice is actually make sure you're talking to the directors of the program and the professors and letting them know your interests and where you want, fill them out. That's the first thing I did. And I think once you have a relationship and they know your needs and wants, they will look out for that. As far as HBCU, make sure the program that you are doing, look at the access for the research experiences and all of that. Make sure that you are your own advocate in making sure your research experiences guide you to where you want to be in your career. But I would do it all over again. I think it's funny, when I came out of Howard University, I was a program director at a research lab, and then I came into NIH, and the director of my program came to me and she was like, I have never known anyone with the education that you all have had at Howard. She said, everyone I have met, because and I don't know if it's just Howard, because HBCUs are so invested in, they know the people that are training, it's their reputation. The people that come out, they're representing them. They're going to make sure you are equipped. And I think that's one of the benefits of HBCUs is you represent them. You don't just represent yourself, and they're going to make sure you represent them well.
Dr. Ebony Madden, NIH Program Director of Genomic Medicine, we appreciate your time, sister. Thank you so much for your hard work and for your example.
Oh, thank you so much. Have a great day.